Hello everyone, welcome to my podcast. Thank you so much for showing your amazing response and your excellent following in terms of my podcast. So I started this podcast with the objective of spreading knowledge in the area of education, health, and lifestyle. You all are really appreciating my efforts in this aspect. And today we are going to discuss about a very good topic that is all about healthy aging. Is aging a curse? So, if we age, are we getting ready to suffer? These are the two important questions that were wandering in my mind. If the age happens to anyone, are we going to have age related diseases? Is really a age a kind of disease? So we are going to get answers from an expert in this area, Dr. Akshata Rao. She is an excellent doctor. She has done MBBS. She is MD from AIIMS New Delhi, which is a highly prestigious institute. She has done her MRCP from UK, and she is very much into this area, who is always working for the best outcomes in terms of healthy aging. So today we are going to discuss so many important parameters in terms of healthy aging, how to be effective after 50 years. That is our major topic. So I request you all to keenly follow this entire podcast from beginning to ending. And if you really like this podcast, please share with your near and dear. Please like it. Please provide your valuable comments, because we all have our parents in our house, and we all know that once the parents become elderly, we have to treat them as our children. So, what kind of measures we have to take today? We will be discussing. Yes, Dr. Akshita, thank you so much for accepting my invitation, and I know you are very busy. Even then, you accepted my invitation, and thank you so much for attending this podcast. So, can you please introduce yourself, Dr. Akshita, to my audience?
Yeah, sure. Thank you, Dr. Rajesh, for the kind invite. And I am Dr. Akshata Rao. I have done my MBBS from KIMS Bangalore, and I have done my junior residency and senior residency in the Department of Geriatric Medicine at AIIMS New Delhi, and I've done my MRCP as well. So I deal with the aging, and the geriatric medicine itself is a branch which deals with older adults. Usually we deal with people above 60 years in our OPDs and inpatients. And so in AIIMS Delhi, we have a national center for aging where we exclusively see older people for all their ailments.
So, that's very nice to know, Dr. Akshita. So, I wanted to know here a few important pointers regarding the healthy aging. So, you often say that age is not a disease, it needs a strategy, because I have read your entire publications related gist and all. So, I came to know that you are totally working in this area. So, what does that mean in everyday elderly care? So, how should we care elderly people in our house? Can you please let us know, Dr. Akshita?
Yeah. So, aging is a natural process. So, it is a very complex process as well. A lot of pathways are involved in the aging, and it is a continuous process. So, from the day we are born, we are aging. But initial few years until the adolescence, we call it as development. But later on, we are starting to age, and it is a dynamic process. So, dynamic meaning there is injury, there is illness, and we are recovering from it, we are repairing from it. And there are a lot of factors which can accelerate aging, and there are a lot of factors which can decelerate aging also. So it is a dynamic process. So depending on how we uh, choose, we can modify aging for a greater extent. And it is a heterogeneous process. So uh, every individual ages differently. So I age differently, you age differently. And upon that, each organ varies aging differently. So it is a very complex process. And like for any long journey, we need a planning. So, similarly, for this complex, continuous, dynamic, and heterogeneous process, if we have a strategy, then it is easier to deal with it. So, as a geriatrician, we usually start with um, setting up a goal. Like, what do we want when we are aging? Suppose if I want to be independent, so it is not just that I have a we work towards long life, we also work towards health in the long life. So that is what we call it as health span. So health span is very important rather than just having number of years added to our life. So to have this health span, we should have a strategy. So to work on this, first thing is we need to prioritize our health. And second thing is, as we all know, prevention is always better than cure. So starting the preventive measures long before the onset of disease is always better. But it is never late to start. Suppose you have a lot of diseases already, it's better that it's not still not late to start any preventive measures. And third thing is you have to personalize it. So it is not, since we have seen that aging is heterogeneous, so it is everybody should have their own personalized strategy towards aging. My strategy might not work towards to you, or your strategy might not work for me. So as a geriatrician, we do a comprehensive assessment, and we look into the capacities and the deficits, and we try to work on the deficit and provide a strategy so that you can age healthily. So
So, Dr. Akshita, what do you think is like healthy aging is in the sense successfully aging in terms of medical perspective and in terms of lifestyle perspective? How do you
yeah.
define it?
Yeah. So a successful aging just doesn't mean that there is absence of disease. So it is not just that. So it involves a lot of other perspective, like having the mental capacity, that is the cognitive facilities, like your brain health also matters, and your psychological health also matters, and your social well-being also matters. So when all these are uh, there together, then only we can term it as successful aging. So it involves a lot of factors, and the with the aging there are a lot of stressors, like there is retirement, there is loss of spouse, or there are major illness or any events happening. So recovering from this is possible only when all the pillars, that is physical health, mental health, and social well-being is there. Only then the recovery, the resilience is possible. So maintaining this resilience and aging successfully is what is successful.
Yeah. So we see that older people have lots of muscle loss. That Rakshita, I am seeing even my parents were very different from their younger age to their older age. So we see lots of muscle loss in older adults. So how can we prevent it or how can we reverse it? Is there any strategy for that?
Yeah. So what we commonly call as muscle loss is we term it as sarcopenia, that is poverty of flesh. So it is a common condition with aging, and there can be a lot of factors contributing to it. So one is that reduced intake, that is reduced protein intake or reduced micronutrients intake, or if you're having some digestive problems, then it can lead to muscle loss. Or there can be sedentary lifestyle, or there could be inactivity or mobility issues due to which muscles which are not being used tend to go for atrophy. And then there could be some drugs which can contribute to muscle loss. But there are a lot of like I said, aging is a complex process. Like there are multiple cellular pathways like oxidative stress or satellite cell, that is the stem cells of the muscles, which are not functioning with aging. And there are micro inflammations and neuronal and vascular changes with aging, which all can together contribute to muscle loss. So definitely the muscle loss is extremely important, and it has to be given importance, because whenever there is muscle loss, there is increased risk of falls. And fall can lead to multiple morbidity and mortality as well. And muscle health is also related to brain health as well. So it is extremely important that we give importance to muscle health. And like you asked, how we can prevent it, the first thing is we need to provide adequate fuel to it. That is adequate protein. Around 1 to 1.2 grams of 1 to 1.2 gram per kg per day protein has to be supplemented in our diet. And second thing is exercise, which is most important part. So strengthening resistance exercises are extremely important, so that the muscle buildup happens and there is no further muscle loss. And it has been seen that the muscle loss begins from the age of 30, and it accelerates as one ages. And it is possible that even at the age of 80, if you start improving your diet and exercise, there is increase in the muscle mass. So it is never too late to start. It is very good if you can start early.
That's very nice. You mentioned about falls. So we see a
Yeah.
lot of elderly people, they fall down, uh, might be because of their less strength in the legs, or maybe because of not having uh, that much of energy, or maybe because of mind disturbances. Whatever it may be the reason, there is a lot of chance of fall. So how can we prevent falls? Like what strategies we can adopt to see that the fall prevention happens?
Yeah. So, like you said, falls can be due to multiple causes. There can be extrinsic causes like the environment related. So, if there is poor lighting, or if they are having slippery floors, or if they're finding difficulty to get up from the washroom, and so all these can contribute to fall. So, environment wise, we can improvise by providing some grab bars like in the washroom, so that they can hold that and get up. And they can be provided with non-slippery shoes with the grips. And they can also be provided with adequate lighting in their room, so that when they wake up in the night, so they can walk carefully and avoid the sharp edges and everything. And also look into the these were the extrinsic factors. Or if they're taking any medication, certain medications also increase the risk of fall. And so you have, it's better that you review the medications with the geriatrician, so that the unnecessary medications can be cut down. And the intrinsic causes, like if they are having vision impairment, or if they are having hearing impairment, or if they are having muscle loss like sarcopenia, or if they are having any neurological disorders, or if they are having blood pressure issues, sudden fall in the blood pressure when they stand. So all these issues needs to be addressed, so that fall can be prevented.
It's really awesome. I wanted to know the major thing, as you told, after retirement, these elderly people become less mobile. In the sense, the mobility is reduced. So, how can we see that the elders are very active as they are in their younger age? They are highly mobile. So, what kind of strategies can we follow?
So definitely, the more, at least if you're like sitting for an hour, it is so bad in comparison to moving in between. So it is very much important that you keep moving. Even if any little thing is required, you get up and go and get it, rather than asking for somebody else to get it for you. And going to the market, or bringing the routine things, whatever you can do, you will have to keep doing as you age. And there are specific exercises which contribute to the overall well-being. So there are basically mainly four types of exercises. One is the aerobic exercises, like walking, cycling, or jogging, or step up, step down. These are the aerobic exercises. Then you have flexibility exercises like yoga or stretching, tai chi, and all that. And then you have balance exercises, where you have toe walking or heel walking or standing on one leg. All these will help you improve your balance. And then the like we discussed in the muscle loss, the main exercise is the strengthening exercises or the resistance exercises, where external weights or bands or own body weight using resistance based exercises can help. The main mantra is that you have to be consistent with the exercises, and you have to keep it simple so that it becomes a part of your routine. And it is always important that you consult your physiotherapist or an exercise expert, because maintaining a proper posture and following a proper technique for these exercises are also extremely important. Doing a wrong exercise might be harmful, so it is better you follow a proper technique, learn properly for at least 1 to 2 sessions, and then you can continue doing at home. So this can help you keeping them active and mobile.
So, I want to know, like, forgetting things is a common thing generally, but after old age, we see that uh, they have this kind of forgetting cycle really high. So we have dementia also a kind of problem which happens. We have seen some elderly people just sleeping on bed and getting up, having food, and again sleeping, not recognizing the people around. So these kind of problems we are observing. So how can we effectively prevent them from younger age so that these kind of problem doesn't happen after some person ages?
Yeah, definitely. Brain health is an extremely important issue, and it is very important that we differentiate normal aging from this pathological aging. So, normal aging, like you said, some form of forgetfulness can be there. So, if it is like you're forgetting things and you're able to recollect after some time, that is okay. And if it is occasional, not regularly you're forgetting, some or the other time, occasionally you're forgetting, then it is okay. And if you're not having any difficulty in performing your daily activities, then it is fine. And if it is you're able to make your own decisions, you're able to manage your finances, you're able to do the activities which you were doing before, that is okay. So when you have to be concerned is that when you start noticing any red flag signs. So red flag signs, like if your parents are forgetting the very commonly, very frequently, they are forgetting things. They are not able to manage their finances, which they were able to do very well before. And if they were cooking before, they have started to mess up things during cooking. And if they're forgetting the common ways in which they used to travel, they're forgetting the uh, travel their destinations. So if all these things are there, it is very important that immediately health concern is there, and they have to be seeking a healthcare professional. So but it is always better to like I said, prevention is always better than cure. If you notice any kind of forgetfulness which is alarming, it's it's better that you go and consult your geriatrician so that they can do a baseline assessment. And there are a lot of forms of reversible dementias as well. So like you said, dementias, there is Alzheimer's dementia or Lewy body dementia, which are neurodegenerative, but there are also reversible dementias which can be correctable. So it's better you seek a help.
So we are observing that diabetes, blood pressure, even cancer, these are the heart attack. These are the common issues everyone is facing nowadays across the globe. So, what do you think elderly people can take some preventive actions so that they don't become victim of diabetes, even though they have it? How they can control that, even have blood pressure or some of the dangerous diseases what I have mentioned. So, what kind of remedial actions, what kind of measures they can take?
So remedial actions as such is, first thing is avoid the risk factors. Like obvious risk factors like smoking, alcohol, these has to be avoided. And second thing is controlling the existing diseases. So if you already have hypertension, diabetes, along with the non pharmacological managements, like I'll come to that a little later, and you'll have to stick on to the pharmacological management as well. And among the non pharmacological aspect, the major things would be having a balanced diet. Like if it is for hypertension and diabetes, sticking on to the diet plans which has been prescribed to you. And again, staying physically active will help you control a lot of things. And having a adequate amount of sleep is also very important. So, with all these lifestyle measures, the diseases can be kept under control, and for much of an extent, we could prevent them from developing as well.
The loneliness is another issue that Rakshita, like we see elderly people have lots of loneliness kind of feeling. So, what kind of measures the family members can take such that they don't feel that they are alone, they are active, and this loneliness feeling is another reason for so many problems as we see. So, how can we avoid
Yeah.
that Rakshita?
So, loneliness, like you said, can impact a lot of things. It can impact your brain health. It can increase, it is a risk factor for developing dementia as well. And it increases the risk of developing depression also. So, it is very important that loneliness has to be taken care of. And first thing is that they can, if it is a joint family, then it is well and good. If it is a nuclear family, the family members can call them quite often, visit them often, and if there are grandchildren, there has to be intergenerational bonding, which will help them, bond better and connect better. And joining a seniors club or senior activity groups can help them tackle this loneliness, and meeting their friends and family members often will help them tackle this loneliness.
It's very nice. So, I have a point here, like, so what kind of measures uh, any person who is crossing the 50-year age mark. So generally, we are treating 50 years. There is no bar for aging as such, but if we take 50 years as the threshold value, so what kind of measures one person can take after 50 years so that these kind of problems which we have discussed doesn't impact the concerned person?
Yeah. So, like you said, age is there's no bar to it. So, I've seen 90-year-olds without any comorbidities and aging healthily, whereas so many 60 years old with multiple comorbidities and looking like they're 80 or 90 years old. So, it is very important that we start from the early age, that like you said, from 50 years or even earlier, from the 30s or whatever it is. So, the earlier the better, but it is never late. So first thing is focus on your diet. So, what you eat matters a lot. So, not eating excess and sticking onto the balanced diet is very important. Having adequate amount of protein and micronutrients is very important. Another thing is staying physically active. Staying physically active from the young age adds on a lot of what we call it as reserve to the body. So that is very important. From the younger age itself, you start being active. That will get carried on. It will be a habit and it will carry on. And controlling the stress is very important. Stress releases the cortisol, and it will lead to a lot of changes in the body. And hence, controlling or managing stress is very important. Sticking on to measures like meditation or calming exercises is very important. Having an adequate amount of sleep is also very important. And avoiding the risk factors like smoking and alcohol is again very important. And you have to keep learning something new every day, even from the younger age itself. Keep learning something or the other every day. It might be a new language, or it might be something you're reading, or it might be a new instrument. Develop a new hobby. And by the time you're 50, when your retirement is nearing, it's better that you have another purpose after retirement. Your job should not be everything to you. Like post retirement, you don't know what to do. You don't have a purpose in life. That should not happen. So develop measures so that you find a purpose in life. Even after retirement, you have something to look forward to, and stay socially connected with your friends, family members, and focus on your psychological needs also, and take care of your mental well-being. That is also very important. So, and if you're having any diseases, control them better. Do not, if you do not have any diseases at the moment, don't wait for the disease to happen to start all the measures. Start the measures beforehand so that you can prevent them from developing itself.
That's great. Akshita. I wanted to know, like, what is the most famous myth about aging?
Yeah.
So, what is
So
the myth? Yeah,
everybody has a concept that aging means decline. It's gonna be decline, and we are gonna be dependent, or it's bad. So it is not bad. There is a lot of part of aging which can be modified through lifestyle and through the attitude what you have towards aging, and having a positive attitude, having a purpose towards life, and having gratitude changes a lot of things. And managing these lifestyle factors, and taking adequate support from the family members and from the healthcare system, can help you age successfully. And aging is not always bad.
that's really awesome, Dr. Akshita. Thank you for letting us know. Coming to your career point of view, so lot many people have dreamed to get into AIIMS New Delhi. So,
Yeah.
how did you make it, Dr. Akshita? So, what is the success mantra to get into that? Can you please let us know?
Yeah, AIMS was my dream college too, and I was extremely happy when I got it. So it was a consistent effort which started from the MBBS days, and then preparing for the AIMS entrance, and working through the clinics would help you gain a lot of insight rather than just sitting and reading books or solving MCQs. So, attending the classes, attending the clinics, interacting with the patients, learning from each patient helps a lot to even for the competitive exam.
One final question. What made you to choose this specialization area, this senior care specialization area in your MD? So, what is the main purpose?
Yeah. So I initially liked interacting with older people, and most of the patients are usually in their 60s or 70s. And what intrigued me was like how we can make things better. They are suffering a lot. With minimal interventions, things can be made a lot better. So I just wanted to explore that aspect. If there is anything that can be reversible, which can be simple and which can be implemented, I wanted to be of help to a lot of people. So I chose this branch.
Thank you so much, Dr. Akshita. It was really very knowledgeable interaction with you, and I came to know so many new points about senior care, because this is a very very important topic as on date, as we have so many elder people in our house. So thank you so much again, Dr. Akshita, for sparing your valuable time and giving us valuable insights. We wish you all the best for your future endeavors from my side and from my audience side. Thank you so much for accepting the invitation.
Thank you so much. It was pleasure interacting with you.
Thank you so much.